the November 9th, 2021 Longmont City Council regular session to order. Can we have a roll call, please?
Mayor Peck,
Here.
Councilmember Hidalgo-Fahring,
Here.
Martin,
Here.
Rodriguez,
Here.
Waters, Yarbrough.
Here.
Mayor, you have a quorum.
Let's stand for the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
So I have a reminder to the public that this meeting can be viewed at the live stream at www.longmontcolorado.gov. Anyone wishing to speak at first call, public invited to be heard, will need to add his or her name to the list outside the council chambers. Only those on the list will be invited to speak at the first public invited to be heard. Speakers who do not place their names on the list will have the opportunity to speak during public hearing items this evening or at the final call, public invited to be heard, any item that you want to speak on at the end of the meeting. So can we have a motion to approve the minutes?
There are no minutes, Mayor, for approval this time.
That makes it really easy.
It
Thank
does.
you. So, Dawn, do we have any agenda item revisions?
There are no revisions, Mayor.
Are there any agenda revisions and submission of documents and motions to direct the city manager to add agenda items to future agendas? Do any council members have anything they want to add? Seeing none, we'll have the city manager's report.
Mayor, Council, I'm going to give you a brief update on the COVID issues as I'm pulling this up. They did not have a administrators meeting tomorrow, and I know hopefully next week in that meeting we've asked for some more an in-depth look at some of the numbers, so hopefully we'll get that next week. So when we look at the cases in the 7-day cumulative case rate that we're seeing in the county, you can obviously see that those numbers, while we were dropping a week or so ago, they are spiking on us. I think at 269.3. What's interesting is if you look at the peak in those numbers today, and you go to your left, I think we're equal to or slightly higher than where we were in December of last year. And for the new member on the council, I get this information from the county. I am not an epidemiologist, but I play one today, and I'm given the information. And so if council has more specific questions, we can take those to Boulder County and have them come forward. But we're seeing a significant increase in the cases. When you look at this, as we talked about before, this is really telling us what those case rates are doing. We're still in high transmission, and you can see that there are some green in here. It is moving back and forth, if you remember when we give these presentations. What's really interesting on this is Boulder County's the second lowest. Grand County's at 165.2, and I think the closest one to us after that's Broomfield. So all the numbers are still pretty high, which shows that we're seeing the same conditions in throughout the state. This is the one that's really interesting. Last week, most of these were spiking upwards. And you can see that the one that's really high right now are the cases in the 0 to 11-year-olds. But we are still seeing upward movements in different groups. 18 to 22 looks like it's spiking as well in this. When we look at it by race and ethnicity, I think one of the things, if you remember early on, when we were heading into the COVID, the percentage of the Hispanic and Latinx population was not close to their percentage of the population in Boulder County. And you know what's really good about this is we're really seeing it stay within a range that's more reminiscent of their percentage of the county population in the Hispanic Latinx community. Longmont is still the majority of cases in Boulder County. We're not at the 40% where we were. We dropped to 39, but we're still seeing Longmont producing most of the cases in our county. When we look at what's happening in the hospitals, once again, we're now down to and this is the North Central region, on the staffed ICU bed availability, we're down to 7%. It was 8% last week. If you've noticed, we've continued to be on these trends. Staff med-surg bed availability is down 7%, moved from 9% to 7%. Tight staffing is 37, that's holding steady. The combined hospital transfer center plan was activated to Tier 3 as of November 3rd, and what that means is they're moving into a different level in terms of how they transport patients and what they use to decide. We now have 92 people confirmed hospitalized in Boulder County. We're not sure that all of those are from Boulder County. I know they were pulling in patients from our neighboring counties as well, and then 19 pediatric confirmed cases. I'm going to kind of hold this slide. Last week when we had the citywide presentation, we brought in an emergency room physician to kind of talk to our staff about what's going on. One of the things that you don't see in this number is that when he was talking about the area that he worked in, it is not uncommon for them to see the hospitals go on diversion at times. And so what that means is that their emergency rooms are overwhelmed, and so they can't take any additional patients. He actually talked about, for the first time in his career, and he's in the South Metro area, where he was seeing individuals who needed to be in ICU that were on a, Sandy, was it a respirator? In the emergency room, or people that were getting dialysis in the emergency room. And so we can definitely see the pressure on the hospitals as we continue to move forward. And so I wanted to give you some tangible examples to the data that we're showing you in terms of what people are experiencing that work in the hospitals. When we look at this, obviously we're exceeding the epidemiological capacity again as we're moving forward, and then this is the one that's probably the most sobering as we're looking at this data in terms of, if you just look at the number of deaths that have occurred recently. We haven't seen obviously this in a while. You're seeing some associated with long-term care facilities, but the majority of them are not associated with it. When we look at testing, I know I had a question on this from Council Member Hidalgo-Fahring, and you can obviously see that the 7-day positivity rate has moved up to 6.7%. As I stated before, this one's a hard one to wrap our arms around because and we've asked them again for some data in terms of the number of people that are actually getting tested, because we know the number of people testing is down. And so if you have more individuals testing because they don't feel well or something like that, it's likely to push this percentage up. And so those are some of the questions that we pushed in last week during the administrators meeting. In terms of vaccination status, Eugene and I were looking at this. It's kind of holding steady right now. To let everyone know, they are releasing vaccinations for children now, and so that's open. If you're trying to get a booster like I am, it's kind of hard because they're really focusing on getting young children in to get vaccinated. But you can see we're still holding roughly at 80% of the eligible population, 76.9% of the total population, and we have about 251,000 that are vaccinated in Boulder County. I wish it were better news today, but we're really kind of seeing this trend once again. I wish we would have had the meeting this week, but I'm going to push in a lot of questions in terms of what we're seeing because this graph is not where we wanted to be at this time. Be happy to answer any questions or try to answer any questions. If not, we will grab those and push them into the county health department.
I see that Councilwoman Hidalgo-Fahring has a question.
Thank you, Mayor. Yeah, and I had sent these questions to you ahead of time, but really, some of these questions, they're coming to me, and I don't have answers, and if this is something we can push to Boulder County Public Health to get answers, that would be great. But really, before we were looking at positivity rate to really determine whether or not to close schools or close facilities and businesses, now, I mean, what are we really looking at? What's the golden number as far as, okay, we all have to be reverting back to online in schools, city council, library and museum operations and other events and so much?
So, and Sandy, can you pull up the website or so they were looking at this threshold, and so what I will tell you is there was a threshold that they were looking at in terms of hospitalization and those things, and basically in terms of what the governor said that they were going to sit from a state standard. We have not. Technically, the only time we really hit that standard was really during that high peak that we saw last year. For the rest of the time, we were below that. Generally, right now, when you look at the conversation that they've been having, let me see if we can find that. Do you know what the one I'm talking about is, where the hospital numbers, they may not have it up here anymore. Yeah, no, it's not that one. So there was another dial that the state was really using, but when you look at where we were in the number of cases, probably we'd have to be at that high peak that you saw in the graph to really hit that threshold. Most of the decisions are really being made right now in it's a hospital data, sorry. At the county level in terms of how different counties are looking at this. And so there have been additional counties bring on masking requirements. So I believe that Larimer has instituted a masking requirement and other issues. But in terms of the decision-making process, the school districts are making those decisions in conjunction with the public health officials in their respective counties. In terms of our meetings, that's something that you all as a council will need to make, similar to what we talked about before. As I kind of said earlier, it really is a risk tolerance question in terms of what we're seeing. And so I know that's not a complete answer, but I can get specifics in terms of the conversations they're having with the school. We're just not part of those.
Yeah, and not just, I mean, what happens in the schools definitely impacts our community as a whole. So I think it is a good idea to be just receiving information, if not from the school district, then from the county,
Right.
onto what decisions or where are they kind of leaning with that. The other thing is, in the event that the transmission rate, I mean, it gets higher, where we might be in a position where we could still maintain some level of in-person, but as far as hybrid format, we had talked about that being an option for city council meetings. Where are we at with, making that a reality?
I'll turn to the
Okay, thank you.
person that's been working on that.
Hello, Mayor Peck, Councilmember Hidalgo-Fahring, Sandy Cedar, Assistant City Manager. So our preference generally is that council either meet in person or meet virtually completely. It's just easier to manage those meetings. It's easier for the public to understand. But understanding that we're in kind of a weird space right now, we are doing some tests with hybrid meetings. We've been able to fix some of the technology, some of the speakers in here so that we can take a look at it. And actually we have a test run next, I think, what did I set it for, Don, next Tuesday? The week of Thanksgiving on Tuesday, to try to see if we can try to figure out other ways to look at potential hybrid meetings, because we recognize that may be a direction the council would like to go. So we're still working on the technology for it. Our preference is one way or the other, because I think it's easier for the public. But we could certainly look at any option that the council is interested in.
Okay, and then, I think, and I'm coming in with the perspective as a teacher where, I've had kids in quarantine. There might be an event where, one of us does test positive, but because we're vaccinated, and we've seen this with teachers as well, that they are well enough to conduct class online from home, but still they have to be in quarantine because they've tested positive. So in the event that that happens to one or more of us, it just seems like we either all go virtual or, if there's a possibility to do hybrid, I think that might be something that would warrant that mix.
Mayor Peck, one other, Councilmember Hidalgo-Fahring, one other thing just to consider is that because we are out of our disaster, our emergency disaster, we'd have to promulgate some special rules. I do believe that Eugene and his office already has those pretty much set up for us, but just as a reminder. One
Okay.
other piece that Boulder County continues to talk about, I think that Harold maybe has mentioned around the idea that, the reason that they're requiring masks is because they don't really want, they're not putting in gathering restrictions at this time because they feel that there's, the vaccination rates are high and they have the masking order in place instead. But of course, the council could decide to go any way you'd like.
Okay. And then the other thing is, has there been data collected on breakthrough cases? What's that number looking like?
The last number we saw, it's still, I think 19% is what they were talking about last week. Is that correct, Sandy? Breakthrough hospitalizations is 19%. I'm not sure what it is in the cases.
And there were other ones that I sent in the email, but it was more directed
Right.
towards me. I did get an email. Oh, sorry. Okay, sorry, squirrel. I did get an email. So what, if there are complaints or concerns of businesses being non-compliant with the masking, where, what can, what are we doing as far as the city, as far as enforcing it, and what can residents do?
Enforcement's through Boulder County because it's a public health order, and so there's the Boulder County hotline number that folks can call in, and so it goes into that group. That group then begins contacting the business in question, and then they move through a progression of steps up to and including going to court and getting injunctive relief on the business. And there were a couple of businesses that they're moving into that step with. Eugene and I have been made aware of one for sure. And so, but they do it because it's really their order and they have the inspectors in there. They will reach out to us occasionally if they need some assistance in monitoring it. But that's in their world.
Okay, thank you. That was all I had.
Councilor Martin?
You Joan, you,
Okay, I know what I did.
okay.
I think I did.
Calling out. 'Cause you had turned mine on.
Let's try it again. I don't see
I'll read
3
back
up
to
there.
She's in, but
I don't see you, so can you turn it off and go back in? It's going to take me a minute to figure this out. I still don't see you. Are you 7 or 3? It's not allowing me. Hold on. Got it.
Okay,
Yay.
so I was also going to ask about breakthrough infections. Breakthrough hospitalizations is the number you have. We don't have any information about breakthrough positives.
No, we can try to get that.
Yeah, that would be good, and this is also going to have to be something that we're going to have to ask the epidemiologist, but I would like us to. It seems to me that with this continued spike, what we're seeing is that vaccination rate plus masking is not slowing the transmission rate. Are they going to be reevaluating our protocols?
I haven't heard that yet in any of the conversations. One of the things that I think folks are looking at, and I can only kind of talk about to a certain extent what we're seeing in our data, is a lot of times, so we're not necessarily seeing when we have positive individuals here at work, it's not a work issue. It tends to be from outside activities. And so that's the hard piece because in a metro area, individuals obviously move in multiple counties. And so literally you can go a couple of miles east and you're not in an area where masking is required. And so That's part of the struggle with this because it's not a uniform masking requirement and you have different counties taking different approaches. So I think that may be just hard to quantify. But we can see what we can find out. I know that there were some conversations with different cities Friday and the Metro Departments of Health. We couldn't join it because we were in orientation sessions. But I know they're starting to look at potential next steps.
Is that your last question? Okay. Councilor Waters, please.
Thanks, Mayor Peck. Harold, you didn't show us any data on our wastewater testing. So if I look at that spike, I realize this is countywide data as opposed to Longmont data. But it would be really useful to see if it's a leading indicator, how useful is it? And what would those data look like 10 days prior to this spike? And what does it look like today that we could anticipate 10 days from now?
We can try to pull it up. I know there were some test results that came back today that were, they had to rerun them. And so it matches it. I mean, we're seeing it in the wastewater match what we're seeing here. So let me see if they've adjusted that and we can bring it up.
If the wastewater is a match to that, then 10 days from now, and if it's a reliable indicator, 10 days from now, it's going to look a lot worse.
Same curve probably keeps us on the trajectory. Let me pull that up really quick.
Well, it ought to inform this discussion of the questions that were just asked about options and when we should consider them. That wastewater data seems to me ought to be informing the timing or the urgency we ought to feel about decision making in terms of
Can you
what
bring
we
it
do.
up? Yep. Yeah, I got this presentation late, so I couldn't add my normal slides into it. Are you in the wastewater? Are you in the wastewater group? Bring ours up first. Yeah, and then the regional. I think Aren has a question if you want to.
Oh, okay. Mayor Pro Tem?
Thank you, Mayor Peck. So while looking for this data, my question first off is that we noted specifically that the highest rate of incidence was in the 0 to 11 age group. And as now that the 5 to 11 emergency authorization is going, hopefully we'll see an improvement there. But it's hard to say at this time. My question though is at overall incident rates going up, is there a point where there isn't again an emergency authorization of authority to you again versus the council? Is there a baseline? Is there somewhere we get where we do reauthorize that?
Yeah, I think.
Or where you ask for that
I
authorization?
will ask for that authorization, and I think the answer is if we get to a point where they start taking actions where, and again, they're not talking about this, so let me be very clear. They're not talking about this, but if we hit the point where they were limiting what facilities could be open and things like that, then that would be a point where we would definitely have to, and the way it would work is that I would declare the emergency and then I would have to bring it back to council to ratify it. But it would really be at that point, or if we were at a point where we were seeing our hospitals be on diversion on a regular basis and we were having transport issues within our fire and EMS group, those would be the trigger points for this, and I'm not hearing that at this point.
Okay, well, that was going to be
Right.
the follow-up question was how close are we to that? Because it seems like we're hearing a very mixed message here, We're seeing these increasing rates, but we're not hearing necessarily, outside of some hospitalization issues that we started to hear from the state government as far as CDPHE and possibly Boulder Public Health. We have not heard too much about any other kinds of economic restrictions so
Correct,
far.
and that conversation is just not there right now.
Okay. Well, I can imagine the governor's not real keen to do that at this time, but
And I think what I would say on this, when you look at this, you know, the challenge in this is, I think, you know, and you'll hear, I mean, you heard the governor talk about this, is, you know, where are people at just generally with this? And I think those are additional challenges that are coming into play. This is the right one. So when you look at this, this graph, you can see what's happening in our wastewater loading. And the blue line, I don't know why it's got this gray piece on it. Yeah, so the blue lines are cases, and you can see the cases moving with what's in the wastewater system. So we're definitely looking at another spike in cases if it continues holding the way it does. There's some nuances in the data, but you can definitely see when we hit this spike here, you can see those cases running up after that. And so we'll get you a cleaner version of this where you can actually see it. But yeah, it's telling us we're going to see more.
well, I definitely look forward to seeing more data after we see more vaccinations for the 5 to 11-year-olds that are now have emergency authorization, as well as more deployment of booster shots as well. So
Yeah.
looking forward to seeing that data and making decisions based on that. So thank you.
Councilman Waters, did that answer your question? Okay, thank you. So thank you, Harold, for that update. It shows that COVID is going to be running our lives for a while here, and decisions we make on every level.
Correct.
So now we have special reports and presentations. Do we have a presentation for the Boulder County Racial and Ethnic Disparities in the Juvenile Justice Committee? Oh, it's Christine.
Yes. Okay. All right. Good evening, Mayor Peck and members of Longmont City Council. I'm Christina Pacheco, Children, Youth, and Families Division Manager in the Community Services Department. I'm here tonight with Shannon Bryan from Boulder County. Shannon is a Strategic Programs Coordinator in the Impact Division in Boulder County's Housing and Human Services. Tonight you'll hear about the work started as part of a county committee that is working on racial and ethnic disparities in juvenile justice. You'll hear an overview of the work that is beginning and learn about future opportunities. I'm going to now turn it over to Shannon to take over the PowerPoint, and there'll be plenty of time to ask questions.
Thanks, Christina. Good evening, Mayor Peck, council members. So as Christina said, my name's Shannon Bryan. I work over at the Department of Housing and Human Services in Boulder County. And I'm serving as the chair right now for the Racial and Ethnic Disparities Committee, focusing on juvenile justice. So thanks so much for having me here. The purpose of this group is really dedicated to looking at racial and ethnic disparities in the juvenile justice system across Boulder County at the county level, and really working with multiple partners on a cross-sector initiative that looks at different data and decision points and then really digs into the why and works on collaborative strategies to address racial and ethnic disparities. So you can see here on the slide who the partners are right now. These are our core partners. We have Boulder County Community Justice Services. We have folks from the state as well. We have Longmont, and we also have the District Attorney's Office, both of our school districts. The Public Defender's Office was a representative member, but right now they've had some turnover, so we're waiting on getting some more folks. And we're also currently recruiting for community and youth members so that we really round out that participation. So just a couple of key terms. You might hear people say MOR, or minority overrepresentation, which really refers to rates of contact and is kind of focused on that data piece or the percentage piece. But what you're seeing is that a lot of folks are now switching to using the term racial and ethnic disparities because it's a little bit more inclusive of a term and talks a little bit more about unequal treatment, not necessarily just the numbers. So really this group is focused on looking at the numbers of youth of color in the juvenile justice system, as well as the treatment of youth of color in the juvenile justice system compared to whites. So here's our process. Basically, we're really just dedicated to this collaborative approach where we bring together key system stakeholders, try to engage with our communities to better understand, again, what's happening, what's the impact, and then look at robust data. So we currently are looking at data at the county and state levels, and then we connect with our community partners to try and figure out what other pieces we might want to look further into, and then develop and implement strategies to reduce disparities that include measurable objectives. So the big question is like why, right? Like why did this group come together? And the most simple answer is because it exists. So we see at the county level, this is county level data, so it's not Longmont specific, it's not City of Boulder, that if we go back over the years, we very clearly have racial and ethnic disparities at in our juvenile justice system across key decision points. So what's used at the federal level and what we use to kind of measure is called the relative rate index. So that's, if you look across some of these, you see the RRI. And what that is really saying that the proportion of the representation of a racial or ethnic group is higher compared to their white counterpart. And we have, there's a whole mathematical equation that we could go into, but it's a pretty clear formula, and the state gives us this information annually. So, simple answer, that's why. The other answer is because we are required to look at racial and ethnic disparities. So, starting back in 1988, the federal government has said that as a justice system, we really need to start looking at and addressing racial and ethnic disparities in this system. So there's the federal mandates that come down. There's also state mandates. So the General Assembly passed the CLEAR Act in 2015, again saying that we need to report, monitor, and address racial and ethnic disparities. And sorry, I just held my breath for a really long time. So I'm just gonna take a deep breath. The other thing is that Governor Polis did also say most recently that his WIGs, or the wildly important goals, one of them is specifically to address racial and ethnic disparities in the juvenile justice system specifically. So why is because it exists, and also because we are required to by law to look at this. So there's also a model for addressing racial and ethnic disparities that we use as a group. This is a model that's used across the United States, and is really we're trained to by our state counterparts. So you can see the model here. It's an iterative process. You start by engaging stakeholders, mapping key decision points, moving all the way down. And I think the key here is, again, you are going to look at each decision point in the juvenile justice system. These are pretty clearly outlined. There's a bunch of manuals, so as a group and as a committee, this is what we're doing, is we look at where the hotspots are across these decision points, and then we drill deeper. And so by drilling deeper, I mean, okay, yeah, there's those numbers, there's that data, but then why does it exist? There's direct causes, there's indirect causes. So direct causes could be something like disparate treatment by members of our system. So arrests happening disproportionately for youth of color, but there's also indirect causes. So some policies, some laws indirectly affect communities of color. There's been some research showing that some communities have different curfew laws, and that disproportionately impacts certain communities. Different communities have access to services and resources for their families. They also have access to alternatives to arrest that maybe other communities don't have. So our role as a committee is to really keep digging into what are the direct and indirect causes. And the whole goal of this is to develop, identify, recommend, and implement strategies to reduce the racial and ethnic disparities in Boulder County's juvenile justice system by looking across all of these different layers. So what are things that the individual youth might need, that their family might need, that schools might need, and what are the strategies that need to be implemented across those levels to really make an impact. And this is really where we work, where we're going to be in the future, hoping to work with our local communities. Again, we're at the county level right now, looking at our data, but we can't implement change necessarily just at the county level. Clearly, we have to work with our community members and our different cities. So where this is housed, if you're just wondering where all of the racial and ethnic disparities work lives, it's housed under Impact, which is a little confusing because Impact is a division in Housing and Human Services, but it's also a 13-agency partnership that's a collaborative partnership, including the District Attorney's Office, the Public Defender's Office, both school districts, a variety of folks. And in 1997, this group was identified by Colorado as being the managed care entity, which basically means that we're accountable for improving the quality of outcomes and the cost of care for youth with complex challenges and multi-system involvement. And we do this through risk sharing and blending and braiding funding. We have a lot of funds that we are actually responsible for that go into prevention and intervention services. So we manage the marijuana tax refunds, which goes towards funding prevention and intervention for court-involved youth. We manage the core child welfare therapeutic dollars, so funds that are used really for child welfare and juvenile justice. So the reason it's housed where it's housed is because we, one, are responsible to the state for it, two, we manage the funds for it, and because of that, we also are required to look at all of these levels of racial and ethnic disparities. And yeah, so that's why it's housed under there, and it's part of our strategic plan as well. So that's everything. If you guys have questions, I would love to answer them. And if you have questions going forward, you can always reach out to myself or Christina.
Okay. I see Councilwoman Martin.
Thank you, Mayor Peck. I do not see restorative justice or any sort of diversion mentioned in this. Could I ask why not?
So it absolutely is a part of it. So when we dig into, are you talking about
Well,
these decision points?
Yes. So referral to diversion, I guess, would be the decision point.
So we would actually, so diversion, depending on if you're talking about municipal or county level diversion, would actually be at a couple different decision points. So we could look at it at arrest, there it is for referral to diversion in between detainment. And right now, as a committee, we actually have decided to focus on the arrest decision point. And so diversion is like an alternative to arrest, but it's absolutely something that we're looking into as well. And by looking into, I mean, who are the youth who are being offered diversion? What's that breakout look like? And what's the success rate?
Okay. And then just, we kind of went through that first table with all the numbers
Really
on
quickly?
it. Really quickly. Could we go back to
Yeah.
that?
Definitely.
The top line, general population, 10 to 17 years old, is this this is the whole county, or is this in the justice system?
In the justice system.
Okay, why do we not show the white column for comparison? Because it makes me not really
Yeah.
very sure what the,
You know, that's a really good point. This table doesn't really show that super well. So we do have tables that do have the white as well. And also you might notice that Native American, Asian, other different breakout groups are not there. I've actually asked that question as well. And the response that I have had from our state counterpart is because our numbers for those specific populations are so low that it's not, that they don't include it because the number of the population is so low, like it's 1 or 2 or 5. compared
that's
to a
pretty
couple hundred.
scary.
I know, and so that is actually one of our recommendations, is because it's a little concerning not to report on it, or to give us that reporting information, so I
Yeah,
100% agree.
I mean, if it's everybody else, you know, Asian, white, whatever, and it's 3, that's really scary. We
Yep.
don't need to break those groups out, but we should show them for comparison.
I 100% agree with you.
If you can get that information, I would like to see the council
Sure.
updated with it.
Yeah,
Because I am not entirely sure how to go back to those, you know, the RRI numbers and
Yeah.
figure out what the disparity. I understand there's a formula, but I couldn't write it down right now.
and just if you are, oh, I don't know how to show it. I had a hidden slide that had the equation. Ah. So this is the equation itself that kind of helps to break it down. And so those numbers right there, by the way, are not our numbers. It's just showing you how to break out the equation. But I do have a table that compares it is still only the white, Hispanic, and black populations, but I do have that table and I can provide that.
That would be good, thank you.
Yeah.
Councilwoman Hidalgo-Fahring?
Okay, thank you, Mayor. So, you know, I have a question on, you know, when we looked at the disparities, or the data that showed arrests, and I think, yeah, so in referrals, so I guess it didn't show the referrals to diversion. But, you know, I was wondering if this committee has looked back even further, so prior to the arrest, what were the trends happening in that youth as far as detention, suspension, you know, issues that were happening at school that kind of later than manifest. You know, one of the key data, you know, one bit of statistics that we were looking at in my work with our teachers union was that, you know, the number of suspensions greatly impacts a student's ability to even make it to graduation. So, you know, has the committee looked into seeing what was happening prior to?
Yeah, so actually, because we are focusing on the arrest decision point right now, we are looking into all of the, again, direct and indirect causes. And so we were able to partner with Omni, which is a research organization, and our state folks to look at some of our school level data for our districts. We've had some of those presentations and we're looking more into it and coming up with some other questions that we want to dig into. Again, because we're looking at kind of the larger level of data, we then want to be able to go back to our partners, so to our individual school districts, to get beyond the numbers as well and to talk to them about that qualitative information. So what does this mean? How is this playing out in your schools? But yes, absolutely. We're looking at what happened at the school level, what happened in mental behavioral health and access to those kind of services, but even further back to that, so if there was involvement in child welfare, what kind of supportive services were available to the family? So we're looking at kind of that holistic picture when we look at the arrest decision point, but we're really trying to figure out the why. And I think as we narrow down, then we start to talk more to our partners about strategies to address them.
Thank you. That's good to hear, because really, you know, I feel like when we're addressing it at the arrest level, it's almost too late. You know, there's so much trauma, you know, poverty. There are many factors that happen earlier in the child. It's history that impact where they're at by the time they make it to the criminal justice system. And the other thing too is looking at school systems. So I'm hoping that the school districts are cooperative and providing, you know, ample data as far as suspensions, detentions, you know, just even the minor infractions. I think, you know, as those build up, that does impact how a student is socially with their peers, with other adults, and with figures of authority. So thank you for that.
You're welcome.
Mayor Pro Tem Rodriguez?
Thank you very much, Mayor Peck. So it seems like there's obviously a good amount of history and then a good amount of data that's already been kind of derived, and you're probably still refining how you collect that data and things like that. So my question really is I don't know if I saw it in this presentation, but is there a specific timeline that you're working on as far as providing maybe recommendations policy-wise? Because as you said, that you're working at a higher level than just here in Longmont at the municipal level. So I'm just wondering, since I don't think I saw that.
You did not see that. So our timeline got a little off course because of, COVID. However, we are still meeting. I think we're hoping to have, so we've had 2 data presentations, one on school systems and then one on referring agency to our juvenile assessment center, to the JAC. And so we have a few more lingering questions that as a committee, we're really trying to understand and gnaw on the data and say, what's this saying? And then we want to reach out to our community partners and get their perspective on what this means. And so I think we're hoping to have that full, robust data conversation completed by February, at which point we would start looking at the evidence behind different strategies and interventions that are effective and shown to be effective at whatever it comes out of the data presentation. And so then we're looking at hoping to have recommendations come out by beginning of summer, I would say, because we recognize that school is also something that's going to impact a lot of folks who are one, involved in our committee, but also involved in planning any intervention or strategy. So.
Well, thank you very much. That gives a better idea of what to probably expect in the coming future here as, we're not too far away from either of those dates. So thank you very much. I very much appreciate the work that the committee is doing and the data that was presented tonight. Thank you.
So no one else is in the queue. I do have a couple of questions. First of all, because this is on a higher level and it sounds like you're just getting it off the ground, what I would like to see for Longmont, if possible, is when we start this program to have the data on where we are at the moment and then end of year and what are our goals? What are we trying to do in Longmont and how does that impact the county's goals? So at this point, the only thing that I know that we're doing, and this could be my ignorance, is restorative justice. And unless, Christine, are we doing any other?
We're doing if you remember the Rewind program.
The Rewind,
Wow.
exactly.
So,
Yeah, okay. All right.
Yes.
and that was a question that I asked Christine. I would like to dig in a little bit more and see what the difference is in communities.
Yes.
Because when you look at, so you take geographic hotspots for arrest and you look at what we've done, what's the name of the program, the gang program?
GRIP.
GRIP.
Right.
So you have GRIP that we have in place, then you have Rewind that we have in place, then you have RJ, which we have in place, which
Right.
what I said to Christine is I'd like to see the community differences in the numbers to see the impact of those programs, because those are diversion. If you look at the left,
Right.
we have a lot of diversion points on the left of this graph.
Mayor Peck and members of council, I would also add, if you look at, kind of off to the right time of day of arrest, and you look at some of the programs that we have that are meant to really target those key after-school times where kids tend to get involved in risky behavior as well. I think that we can add to the data in those areas. And some of, as Harold talked about, the geographic hotspots for arrest, we're looking at through Children, Youth, and Families what it might look like as a community response model, working with our community and neighborhood resources to provide some of that mobile programming and mobile intervention as we look at how we can do that in the new year and look at where we're seeing some of those hotspots and really being proactive in getting out there and making connections with youth.
Great, it sounds great. And just to echo what everybody else on this council said, I think it's really important to possibly work with school counselors so that we get to the root cause
Yes.
before it becomes a huge problem. And so thank you very much. It's a great report, and I like the way we're going forward.
Thank you. Thank you.
So we are now at the exciting part of the public invited to be heard. So I want to remind you that you have 3 minutes, which I'm going to. Mayor Pro Tem is going to be the timer. So the first person up is Olga Bermudez. And I remind you that you have 3 minutes each. Does it like you sitting there, that timer?
We'll find out soon enough.
Okay.
Let's wait until we get through the first part and then start.
All right, I think that was working. Good evening, Mayor Peck and City Council members. My name is Olga Bermudez, and I work for the City of Longmont at Children, Youth, and Families. I'm here tonight because I would like to introduce you to Longmont Youth Council. So they have been working really hard during the past year. So they're going to share with you some of the challenges, some of the progress that we have been able to make through this past year and a half. So I would like to invite them just to introduce themselves and share some information.
Would you mind, I know that you're going to say your name, but would you state what school you're from too?
Yes,
That would be
will
great,
do.
thank you.
All right, hello City Council. Thank you all for having us tonight. My name is Emma Milchuk. I'm a junior at Silver Creek High School. I've been in the Longmont Youth Council for 4 years and I am currently secretary. Here with me tonight are some of the other leaders and members of our council to again talk to you about our council and the activities we embark on.
Hello everyone, again, thank you so much for having us. My name is Austin Brubaker and I'm the Vice President of Youth Council. I go to Silver Creek High School and I am a junior and I have been in Youth Council for 3 years now.
Hello everyone, thank you for coming. My name is Allison DeBee. I am a junior at Longmont and this is my first year.
Hello everyone, I'm Catherine Bogdanova. I'm a junior at Silver Creek High School and this is my 2nd year in Youth Council and I'm very excited to be here.
So, as you're all likely familiar, Youth Council is our youth's chapter in the government, featuring members from grades 8 through 12 in varying schools within our district. Through our liaison, Olga Bermudez, at the Children, Youth, and Family Center, we've been able to meet for years in order to address and advocate for issues facing our youth and our community. Though our meetings are virtual right now due to the COVID-19 pandemic, we've been able to meet over Zoom nearly every other Tuesday to discuss issues, solutions, and problems. We currently have 15 members from Silver Creek High School, Niwot High School, and Longmont High School, and we are all members of Longmont community and surrounding communities. We're very grateful to be able to contribute to our city through our own actions and through the actions of our supporters and funders like the City Council. As always, we have a few annual projects. For example, our Halloween for the Hungry event is a food drive occurring on around Halloween, where we collect non-perishables for people in need. Last year, we collected 1,473 items and we were able to donate these to a local food bank. This year, we were also able to complete a COVID-safe pickup of these items, and we have yet to tally up the total. This is just one example of the many projects that the Youth Council leads and is a part of.
This past year, despite the unexpected events of COVID-19, we've been creating and working on new projects such as our year-long environmental project, where we mainly focused on social activism and spreading awareness. The environmental committee within the council created posts for Facebook and other forms of activism. We also have been working on a new mental health project we named Refind Your Mind. This project was a forum where youth and adults shared their experiences dealing with mental health issues and were able to express how they were able to overcome their struggles. Youth Council members also worked with and tutored elementary school students through Longmont's Reading League, where volunteers would join a Zoom and help bilingual students practice their reading, writing, and other language skills in English. Many of these projects were highly successful and we'll be continuing them through the next coming season of Youth Council, along with following up on new ideas for better ways to better our Longmont community.
Though we were able to create an impact through many of our projects we worked on this year, we also evidently faced various challenges and setbacks. For example, during our environmental project, despite setting up creating infographics, they were posted on Facebook but had a challenge on our part. This blocked the actual public launch of our project. This was somewhat frustrating. We also were able to learn from it. One idea we had about it was improving that would later be on our own social media accounts to post these infographics and be able to appeal our target audience, the youth within our community. Another challenge was having our meetings over Zoom, and I'm sure we weren't alone with these struggles. For example, and understandably, some of our members would not turn on their cameras, and there were some challenges with vocal participation. We found that there were some trends in members who were actively voicing their opinions and would sign up for duties within the council, versus those who didn't. While these challenges were a little harder, we encouraged all members to participate, turn on their cameras, and contribute to the meetings. Thankfully, and after a little bit of encouragement, most members were able to participate in various issues we discussed. We also found that our new plan for Halloween for the Hungry, which included social distancing between members and other COVID-safe measures, collecting was a little disorganized. This year, we made maps to collect food and had specific dates to pick up food and drop off flyers and other important steps. Through these struggles and others, we were able to form new ideas and apply these challenges to our projects.
During this year of Longmont Youth Council, which recently started in August, we have already completed many successful projects that have positively impacted our local Longmont community. Recently, we completed another year of Halloween for the Hungry, which was earlier mentioned by Emma. This was a very fun and successful event that definitely left a positive impact on our community. Our youth council has already started to begin creating ideas for future projects. We recently spoke upon the idea of possibly having a youth council public forum where we'll be able to hear from the youth as well as teachers and parents and people around in our community, so we're able to understand the problems that they think are most important, and we can create projects to help those issues and to better our community. By hearing these significant issues that are affecting the Longmont community, we'll be able to better understand what we should work on and what we can do to address these issues. We're also always open to recruiting new youth council members. We recently were able to recruit new members from Longmont High School, and even though this year's application deadline has passed, we're always open to hearing the interests of youth around Longmont who would like to join. We want to continue gaining members from all around Longmont, and this will also help us better understand the issues we want to address. We recently were also able to give away grant money to community projects, which we believe deserve the money and will use it for a good cause. This process includes our youth council members reviewing all the grant applications and then interviewing the applicants and understanding their purpose. We also want to make sure that we're giving the money, distributing it fairly and giving it to projects that we know will have a beneficial impact. This makes sure that the money is distributed well, and we also hope to continue giving out grant money because it does have a real impact on our community. We are very thankful for being here tonight in front of the City Council, and we thank everyone for your time and support of the Longmont Youth Council. We hope to continue growing our team and positively impacting the community and the people around us. We are now open to any questions anyone may have, and also if you need any clarification or want us to elaborate on any parts of our presentation. Thank you.
Who is to? Councilwoman. Oh, that's right. Well, I'm sorry. We usually don't interact with public invited to be heard. But if any counselors have questions, you can email Ogle Bermudez, and she will pass that on to youth council. Oh, and yes, and Councilwoman Hidalgo-Fahring is the youth council liaison. So she can get your questions as well and find answers for them. So thank you very much and good luck. Next up, we have James Kenworthy.
So do I need to punch a button here to get things? Okay. James Kenworthy, 107 Caribou Place. Longmont is 150 years old. I'm not that old, but I am over halfway there. I've been living here about 46, 47 years. And I just came here tonight to tell you how happy I was here last night, and I can't tell you. Yes, I can. I was so happy and proud to see this group. And if Tiny Tim were here, he would say congratulations to us, everyone. Thank you.
Thanks, Jim. Well, now we are at the consent agenda. Don, would you read the items on the consent agenda, please?
You bet, Mayor. Item 9A is ordinance 2021-69, a bill for an ordinance making additional appropriations for expenses and liabilities of the city of Longmont for the fiscal year beginning January 1st, 2021. Public hearing and second reading scheduled for November 30th, 2021. 9B is ordinance 2021-70, a bill for an ordinance amending section 3.04.885 of the Longmont Municipal Code adopting an amendment to the City of Longmont Police Employees Pension Plan and Trust Agreement. Public hearing and second reading scheduled for November 30th, 2021. 9C is Resolution 2021-116, a resolution approving a certificate of compliance in support of an application requesting coverage under the FPPA defined benefit system administered by the Fire and Police Pension Association for new police officers in the City of Longmont. 9D is Resolution 2021-117, a resolution of the Longmont City Council approving the agreement between the city and the Temple Hoyne Buell Foundation for grant funding for the Longmont Bright Eyes Initiative. 9E is Resolution 2021-118, a resolution of the Longmont City Council approving the intergovernmental agreement between the city and the United States of America for the Institute of Museum and Library Services grant funding through the American Rescue Plan Grants Program. 9F is Resolution 2021-119, a resolution of the Longmont City Council approving the intergovernmental agreement between the city and Boulder County concerning the use of a City of Longmont van for the COVID-19 shelter for the homeless. 9G is Resolution 2021-120, a resolution of the Longmont City Council approving the intergovernmental agreement between the City of Longmont and the United States Geological Survey to provide stream flow gauges on the Boulder, Left Hand, and St. Vrain Creeks. And 9H is City of Longmont Youth Council appointments 2021-2022.
Thank you, Mayor Peck. I move the consent agenda. Happy to amend if any other council members would like to pull something.
So it has been moved by Mayor Pro Tem Rodriguez, seconded by Tim Waters. Can we have a vote, please? All those in favor? Oh, good, we're using the, go. So that passes unanimously. So we get to jump immediately to the ordinances on second reading and public hearings on any matter. We have A10A 2021-67, a bill for an ordinance designating the Hawkins House at 821 Collier Street as a local historic landmark. Do we have a staff report for this? No. Do any counselors want to have any comments? No. Mayor Pro Tem Rodriguez.
Thank you very much, Mayor Peck. As the liaison to the Historic Preservation Commission, I will say that they unanimously voted to approve this designation. As we heard, there was no objection in the first reading of the ordinance, and so I strongly suggest that we approve this.
Would you like to make a motion?
Mayor, we need
Oh, we have public hearing, that's right. Is there anybody in the public that would like to comment on this ordinance? Hearing none, Mayor Pro Tem?
Thank you, Mayor Peck. I move approval of ordinance 2021-67.
Okay, it has been moved by Mayor Pro Tem Rodriguez, seconded by Councilwoman Martin. Let's have a vote. And that passes unanimously. All right, let's see, we are really moving through this. So we have another ordinance, 2021-68, a bill for an ordinance authorizing the city of Longmont to amend the lease for Vance Brand Municipal Airport hangar parcel, known as hangar parcel SH6T. Do we have a staff report on this? No. Council, I don't see anybody in the queue. Does anybody from the public like to make a comment on this ordinance? Seeing none, I would like to ask for a motion. Does anybody want to move this ordinance?
I'll move ordinance 2021-68.
It has been moved by Councilwoman Hidalgo-Fahring, seconded by Councilmember Waters. Can we have, let's have a vote for it. And that passes unanimously. There were no items removed from the consent agenda. So now we're on to general business, which is the city council meeting calendar for 2022.
Ready? Okay. Mayor Peck, members of council, Sandy Cedar, Assistant City Manager, we are here to set your calendar for the year. So we have made some suggestions just based on how things have gone in past years. But essentially what we'd like to do is provide a little certainty for folks around holidays and for staff around planning for items. And so just kind of going through the calendar, traditionally we go through this month by month. And if that's okay with you all, we can do that again. Okay. In January, let me share with you, in January, what we are proposing is to have regular sessions on the 11th and the 25th, open forum on the 18th, if that's something that you would still like to do, and a study session on the 4th. So four meetings in January, if that is good with you. I'll just keep going until someone stops me. How about?
Can I just break in for a minute?
Sure.
Councilwoman Yarbrough, you had mentioned that you would like to speak at this time. Are you still interested in? You had mentioned you wanted to propose a change? Councilwoman Yarbrough, go ahead, you have the mic.
Thank you, Mayor Peck. I just want to say you're doing an awesome job.
Oh, thanks.
Because, yeah, don't worry about it. You're doing an awesome job. Yes, so I was looking at our the charter, and the charter stated that we have to meet at least twice a month. And I was wondering and proposing that moving forward, if we can have our meetings twice a month instead of every week. And I would like to know, see how council feel about that.
So normally we would have a motion and then discuss that, but I am wondering at this point, because this is absolutely a new idea, if council would like to just have an open discussion before we make a motion. So once again, I'll repeat, you are, per the charter, requesting that we have 2 meetings a month rather than 4. And Councilwoman Yarbrough, do you have in mind a structure as to how that would look? For example, would one of them be a study session and we have to have 2 regulars, we have to have 2 regular sessions. So how would we work a study session into that idea?
That is a really good question, Mayor Peck. And I think for me, I wanted to bring it forth to council to get opinions, and then also probably talk to city manager to make sure how that structure will work with the employees as well. So, yeah, so I know we have to have 2 regular meetings no matter what. That's what's in the charter.
So you mentioned this to me, and I do see someone in the queue, but if you don't mind, I would like to just give a little pro and con from my perspective. 2 meetings I think a month would probably take some pressure off of staff, because I'm sure after the Tuesday meeting, we set the agenda for the next meeting on Wednesday, and then they're working nonstop to make that next meeting work. So I'm just throwing that out there as a pro on perhaps staff's part. A con would be if there was something that absolutely needed to be brought to council. Would it be outside of these meetings, these two scheduled meetings? And would the city have the ability, staff, to call ad hoc meetings? These are just things I'm throwing out for discussion. The other pro, from my perspective, is that I know that our last packet was 1,100 pages. And getting that on Thursday is a little tight, preparing for council on Tuesday, or even if it's 600. So that would be another pro, to give us more time to read the packet. So now I'm going to turn it over. I see that Councilwoman Martin is in the queue, and let her give her opinion.
I am not opposed to this, but I think the pacing of it needs to be carefully considered, because what you don't want, I think the standard model for this is that you have a study session first, so the meeting is longer. It would maybe start at 5 in the afternoon instead of 7. If you have a 2 to 3 hour study session followed by the regular session, the study session should not be on what's on the consent agenda. So there should be you'd need to have a 4-week schedule, because you'd need to have a study session on the things that were going to appear on the consent agenda 2 weeks later. And that would be good, because you'd get plenty of time to do research on what kind of discussion you wanted to have on the consent agenda. So that would be great. So the question is whether the staff is that far ahead and can make that kind of pace. And I can't speak to that because I don't know what the operations are, but is it appropriate to ask the city manager to speak to it, or one of the assistant city managers to speak to it?
Absolutely.
Then.
So, yeah, I think you can manage that. We do have to plan more, so that's where, if we have the question now and we have the decision, it's easier for us to plan and get that going. So I think short answer is yes, we can work through that. And it's not like, I mean, to be frank, kind of in previous cities I've worked in, we had the same model, and so we had to work through that kind of schedule too. So if you all decided today, that would give us time to figure that out.
Any other discussion by? Yes. So, Councilor Waters.
Thanks, Mayor Peck. I can imagine why the staff would favor going to 2 meetings a month. And I can understand why we would want to go to 2 meetings a month to take some of the. My concern is the evenings when we're here till after 11 o'clock. I mean, I don't know how many times, but it's been a number of times we've moved to continue a meeting beyond 11 o'clock because of what's on the agenda. Those are frequently the evenings where we have a large number of people who are, wanting to address the council during public invited to be heard. My concern is I would rather meet multiple times than be here till the wee hours of the morning. That's the concern. So I would be personally inclined to say, if we wanted to do this, to say, well, let's try something on for a quarter, right? To test it for a quarter, see how it works, and then make a separate decision about whether or not to continue, rather than tonight or a week from now or a month from now, decide for the rest of the year that we're going to meet only twice a month, just because of what potentially backs up. We have some agendas that are pretty light, and then we have agendas that are monsters, 1,100 pages or whatever. And I'm a little concerned about what happens in terms of the backlog and the work, so.
Okay, I see Mayor Pro Tem Rodriguez.
Thank you very much. Including the concerns of Councilmember Waters, some of my concerns are, one, when we are in need of executive sessions, for instance, and how that will work as far as we will need the flexibility to absolutely call special meetings if we go to a 2 meeting per month schedule, especially if we're already starting basically study sessions at 5 and having been in study sessions that have also gone well over 2 hours. That's a concern. Also a concern for me is that regardless of the fact that we're going through what would be study sessions from 5 to say 6:50, is transparency. We're already accused enough of not enough transparency by the public. And so by shifting study sessions to 5 to 6:50 per se, makes it less accessible, in my opinion, than starting at 7 for the generally one-off schedule that we currently have, or that we've been running for apparently a number of years. So those are two of my concerns, and so I would really like to say that if we do move to the 2 regular session meeting per month thing, that we do provide enough flexibility for special meetings, and also address transparency issues if possible, as well as the ability to also accommodate executive sessions, because those tend to come up really without a lot of notice a lot of times, and where we're even said, oh, we need to call an executive session, and within a week we'll be notified of that, because as long as you notify it a certain way, it sticks to being in compliance. And so those are my concerns. I'm not against it, but I definitely would like a good, strong consensus by City Council. And I do agree that maybe testing it for a quarterly basis at least is probably a prudent approach if we're going to change what has been traditionally basically a 4-week schedule per month. So, thank you.
What number are you? You're 4. I'll get this yet. Yeah. Councilwoman Hidalgo-Fahring.
Thank you, Mayor. So my concern is, periodically we've had to meet as the LHA Commission. So how would that impact? I mean, maybe is this something that we want to wait until we are no longer, in control of the LHA, and then, maybe revisit this after that point? My concern is that we're going to run out of time.
You all will be the LHA board now in perpetuity.
In perpetuity.
Yeah.
So So I guess my concern is, would we have enough time to address business that we need to be taking care of if we cut back? That was it.
Okay.
Just, what are your thoughts?
All right.
So I don't know. Just throwing it out there.
Councilwoman Martin.
Thank you, Mayor Peck. A couple things. First of all, there's the open forum staring us right in the face. That has to be a 3rd session, right, in the months where it occurs. Because it's really important to the public. We should always do that. What I might suggest is that we have a designated 3rd week where maybe people would not make plans, but typically not come in for a meeting, and that would be where the LHA or executive sessions could go. And then we would have another week or 2 weeks, depending on the month, where people could count on not having to come in. So maybe the week between the 2 regular sessions could be, as it is in January, the day when special stuff happens. And if we scheduled it that way, everyone would know what to expect. I don't know how others feel about that, but I thought I'd put that out.
So here's what let me see if I can sum this all up. Councilwoman Waters said we should try it for a quarter, and I think we had pretty much consensus on that. The concerns about LHA came up. The open forum came up, which is valid. We absolutely have to have those. And executive sessions with transparency. So here's another idea I would like to throw out. How about 3 meetings a month, with one of them being, and I think this is in our charter, one of them being a study session, with the idea that staff has at any time the right to schedule an ad hoc meeting whenever they thought they needed to bring something to council, or they needed us to meet for executive session, for LHA, if it's something out of the ordinary that they really needed us to all meet. So.
Mayor, could I clarify that just real quick? So what you're saying is, for example, the second and fourth sessions would be regular sessions starting at 7.
Right.
And the third session in the middle would be a special session, either an open forum or an LHA board meeting or a study session, or starting at 7. Is that what you're saying?
That's just an idea, and if somebody wants to make a motion, I'm just trying to gel all these ideas together so that when you do make a motion, it'll be a motion that hopefully makes sense. Can you turn that off and on again?
Well,
you're
it's
already
hot.
on.
I just,
Okay.
all I wanted to just clarify.
Okay.
I wasn't proposing that we pilot this for 3 months. I was saying if we're gonna do it, we ought to
Exactly.
put a time frame around it to test it. I wasn't trying to advance the idea that we do it, just that we ought to work our way into learning our way forward.
Thank you for that clarification, and I was just trying to get everybody's comments down so that we understand what everyone's thinking. So, let's see, seat 7 is Councilman Martin. Now
Thank
you're
you,
ready.
Mayor Peck. The only concern with the format that the mayor proposed I have is that it doesn't necessarily have enough time for study sessions. Because maybe 1 month in 3, there wouldn't be a study session because there was gonna be an LHA meeting or an open forum or something. And if it was, all the meetings still started at 7 and there was only 1 study session, unless there was something else, that's not enough. Maybe we could have a modified version of that where the study session at least would start at 6, or maybe there could be a mini study session ahead of the regular session and start at 6. I thought starting at 5 was pretty aggressive because a number of us have day jobs, and so that would make for a pretty long night. But I don't think just 1 study session that sometimes gets preempted is enough time for study sessions.
So, I think that is a decision that staff probably should make, deciding if there's enough time to get through what their agenda is. I don't know. So if somebody wants to make a motion or not, I'm not sure. Well, let's make the motion and see if it passes. I mean, Councilwoman Yarbrough, do you want to make a motion, since it was your idea?
Yes, I would like to make a motion. I also want to state, I appreciate all of you even making I'm not 100% understanding all the meetings of how long they actually takes as far as the study sessions and everything, but I also think it's so important for working people to have a little bit more equitable meetings, and not only just working people, but also people who come to council meetings too every week that are very long. So that was my purpose of bringing this to council, was making sure how we can make sure that our meetings are more equitable in that way for our community and those of us who work full-time jobs as well. And not to take away the responsibility of what council has to do, nor take away the responsibility of staff. So first of all, I appreciate everybody considering it. So I am definitely open to the 3 meetings I propose, or I'm making a motion that we have 3 meetings a month, which would fill the requirement of the charter of 2 meetings, at least 2 meetings a month, and understanding that there will be times where city will have to call us in for an ad hoc meeting to go over anything else or executive sessions or anything like that. So I'm making that motion, and also that it will be a trial period, and we will try this out for a quarter, if council agree with that. 3 weeks, 3 meetings a month, and also where staff can call in an ad hoc meeting for council.
Okay.
Did I say that right?
Yeah, it was pretty clear. I can,
Eugene.
let me reword it the way I think you said it. So you are making a motion to move that council changes the meeting format to 3 meetings a month, with a caveat that staff can call ad hoc meetings as needed. 2 of the meetings would be regular session, 1 of the meetings would be a study session. Is that, does that pretty much sum it up, Councilwoman Yarbrough?
Yes.
Thank you. Is there a second for this?
Second.
All right, it is, Councilwoman Yarbrough made the motion. It was seconded by Mayor Pro Tem Rodriguez. Let's vote. Oh, okay, sorry. Discussion.
Thank you, Mayor. You know, and I guess my question is involving starting time. So if we have the 2nd and 4th as regular sessions, would we just our start time be at 7, or would we be required to attend earlier? You know, as a person who does work full-time, you know, when we have the 5 o'clock, I mean, I'm coming straight from school, and it's like kind of pushing it as far as, you know, me being ready to step away. So, you know, and for executive sessions or, you know, just emergency meetings, that's where it's sporadic, that's okay, I can do that. But to have that be a habitual pattern, that is going to be difficult. So, you know, and the third, with the third being a study session that is embedded in it's not, that's not the ad hoc. Is that correct?
Correct.
Am I understanding that correct? So it'd be the 3 meetings. So I just, my concern is looking at start time. So if somebody could answer.
Harold, would you answer that, please?
Yeah, I think based on at least what the motion that you have in play right now with 2 regular sessions and 1 study session, I would see the start time still being at 7. And then if you had to have an executive session, the executive session would work like it normally does now. And then we would be very focused on the study session and on that 3rd meeting. And I think that's what we would manage. And then the study session, actually most of the housing authority stuff, because you all operate at a different board, we can then be very focused on that's a housing authority day 2. And so that's kind of the structure. It was hard for me to say here's how it would work, but I think now based on this I could see how that would work, and 7 would still be the start time unless we had an executive session, and that would work like it does now.
Okay, thank you, that clarifies a lot for me.
Mayor Pro Tem Rodriguez.
Well, thank you, Mayor Peck. So I would ask Councilmember Yarbrough if she would accept an amendment to her motion to specifically state that the meetings would start at 7, that the meeting that is not a regular session be a study session and or a special meeting, dependent on whether it's an open forum or a LHA board meeting, as well as that also does leave us the 5 to 6:50 hour prior to for executive sessions if they're to be called, as well as the possibility that we could call those also for special meetings similar to study sessions. Would you accept that amendment to your motion?
I will accept that amendment to my motion.
Okay. So, do we vote on the amendment? Yep. There's nobody else in the queue. So let's vote on the amendment, and then we'll vote on the amended motion. So the amendment to the original motion, correct me if I got it wrong, is that will you restate that for me? It was quite a long amendment.
Thank you. It was to specify 7 p.m. as the starting time for the meetings, as well as that the third meeting of the month that's not a regular session be flexible in the sense that it's either a study session or a special meeting for other purposes such as open forum or LHA board meeting, and that we allow that we can call executive sessions and other special meetings from the 5 to 6:50 hour.
Okay, thank you. I'm not going to try to repeat that. So do we have a second for that amendment?
I'll second.
All right, it's been, the amendment was made by Mayor Pro Tem Rodriguez, seconded by Councilwoman Hidalgo-Fahring. So let's vote. Oh, wait a minute. I had to get out of that screen. So that carried unanimously. Now we need to vote on the original motion as amended. So that was made by Councilwoman Yarbrough and seconded by,
I think it was me.
it was Mayor Pro Tem Rodriguez. Oh, yes, I'm sorry. And that carries unanimously.
So Mayor Peck, can I go through just the first 3 months and then we'll do a reassessment?
Please
Okay.
do.
So if you're looking at January, that would mean that we would cancel the 4th as the study session. The 18th would stay as the open forum, 2 regular sessions. Then in February, we would cancel the 1st,
Okay,
have 2 regular sessions and 1 study session / LHA on the
Okay.
15th, right?
yes.
Then in March, we would cancel the 1st, which is a study session. Now, in March, there's a couple things going on here. So you've got the study session on the 15th is also the NLC Congress of Cities conference, if that's something that council members are planning to attend. And then the next week is spring break. So what we have done in the past is actually canceled the 22nd. Sometimes we've done that 15th as well. So we could certainly move that around any way that you'd like. If you would like, you could do your study session on the 1st, regular, cancel the 15th, 22nd, and the 29th be regular. Yeah, does that sound good? Okay, so the proposal is to keep the study session on the 1st. Keep your regular session on the 8th.
Yes,
Cancel your study session on the 15th and the 22nd.
Correct.
Regular session on the 29th. Okay, and then at the end of March, we would do a reassessment of this to see how it's going?
yes, I think that would be a great idea. This is going to be a good experiment.
Okay?
I do have a question, and this is a little bit out of, do you know if NLC is going to be virtual or in person this year?
I have not heard either way. Have you heard anything, Dawn? I haven't heard either way.
I don't
know that
believe
they-
they've made that decision yet. Mayor
Yeah.
Peck.
Okay,
We should hear soon, though. And you could always change this if they decide to do it virtually.
well, and I think that would give us some leeway if it's virtual, so that even if we needed to have like an ad hoc meeting, there'll be enough of us here to do that. So
Okay?
this could work in our favor.
So a couple of things. One, we'll have to bring a change to the council rules of procedure for this test.
Okay.
The other thing, are there any holidays that we need to be aware of outside of this more long-term that council will need to potentially plan for
You mean past March?
past March?
Yeah, so there's April.
I mean,
May, we usually do cancel that fifth one anyway in May, June.
Right.
So June would be one that you might want to flip that the same way so that people could go to CML.
so
It's
just
not a holiday, but
So assuming that we stay on the regular schedule in May, I would go, do you all want to cancel the 5th and Monday, the 5th Tuesday in May just now so you can plan
yes,
if you need to?
that's a good point. Why don't we go ahead and finish the rest of the calendar because there may be ones that you want to cancel no matter what. Yeah,
Okay.
that makes sense. Okay, so if this is March. April, right now, we'll just leave it as it is. There aren't any holidays or fifth study session. So May is a great point. Would you be interested in canceling the 31st?
Or the 3rd and the 31st, or,
Well, I think you'll reassess that in March. And so if you decide, yes, you're going to cancel that second study session, the question on this one is just, are there some holiday times that you'd like to go ahead and cancel through the whole rest of the year that you already know today? So the 31st. See. Yeah, cancel the 31st. Yeah.
yeah.
And then in
Fun.
June, if you're interested, you could cancel the 21st for the CML conference.
Yeah,
Okay.
I think that's a good idea.
And July 4th is actually on that Saturday beforehand. Sometimes we cancel the study session after July 4th, but it's not real close this year.
Change the screen.
Oh, sorry, July, I lied. I was on June.
Yeah.
So
July.
July, would you be interested in canceling the 5th?
Yes,
And would you like to hold an open forum on the 19th? That's your second one if you're
Yes.
interested. Okay, great. Yeah, that's a good point, Harold. August, you have the 5th study, the 5th session would be on the 30th.
can we, how about canceling the 16th and the 30th?
Canceling the 16th.
We'll need
No, we
the-
can't do that,
We'll
Carrie.
need the 30th.
Don't we
Yeah.
need the 30th
30th
the
for budget?
Yeah, yep. we
So
need
it would be the
30th for
16th.
So cancel the
Okay.
16th, got it.
Yeah,
Hey, there you go. That's right, all the calendars running through the head, right? Yeah, okay. And then September, you have Labor Day on the 5th, so the introduction of the budget actually is the 30th in this case, right, Jim? Yeah, so you could take the 5th off if you wanted to.
6th.
the 6th.
6th off? Yes?
That one, we may need to have some flexibility on the 6th for budget, so
You want to keep it on for now?
So can you just clarify something? Did you just say the 30th of August is when we intro to budget?
Yep, that's the plan.
So you want both the 30th and the 6th for study sessions?
Jim said.
yeah, we
did
skipped
skip
it this year actually, so we could probably cancel it because we,
It was similar.
it
We were
was
able to
similar, it was
introduce
a
budget in
similar, and
August instead
we
of September.
introduced it and did more work in August,
So I will
so.
cancel the 6th.
I personally would like to leave that up to staff. If you need us to come on the 30th, can you just, for budget?
We will need you on the 30th.
We will need you on the 30th.
And the
It's
6th.
September 6th, so we'll leave it on for now, and then if
Exactly.
we don't need it, we'll cancel it.
Right.
Yeah.
Oh, there you are.
I am wondering if, because it's budget, and also because, we're being equitable, Rosh Hashanah, which, the war should be over by then, let's do 2 consecutive regular sessions on the 13th and the 20th, and then cancel the 27th.
Okay? So we'll leave on the 6th, 13th, 20th, turn the 20th into a regular session and cancel the 27th.
That sounds good.
Okay.
Yeah, we missed
And
that.
then if we need a pre-session or something to that effect, we could always do that too. Okay. Okay, October. 4 sessions?
That's pretty straightforward.
Yeah, it is pretty straightforward. November, oh, the fun of November. So we do generally try to cancel, we certainly try to cancel Election Day, we try to cancel Thanksgiving break. Sometimes NLC is that week, but it looks like it starts a little bit later than Tuesday, so hopefully people could get there if you did want to do the second NLC. So your choice. I would generally, we would have canceled Election Day, the 8th, and the 22nd, which is Thanksgiving.
So that only leaves us
thought
with
it was
one
the
regular
first.
session.
Oh, that's a
no,
good question.
2. There it is. I did not scroll down far enough.
Well, isn't Election Day the first Tuesday after the first Monday?
Oh, yeah.
We will cancel whichever one is actual Election Day.
I think you have it correct.
I always thought it was the first Tuesday after a first Monday of November.
Right.
Yeah. Okay. And then, yes, on Thanksgiving break, Thanksgiving, okay. Okay, very good. And then December, we usually try to combine some regular sessions. In this case, just by the way it's laid out, maybe the only one you'd need to cancel is the 27th.
Yes.
What did you say? Oops, sorry. Advance. Oops, wrong way. Okay. So definitely cancel the 27th.
Yep.
Okay. All right, we'll bring this back as a more set schedule for you all to take a look at, as well as do they have to do the rules of procedure for 3 months just to get it started, or once they finally make the decision? Yeah. We'll bring back whatever we need to
Let
bring
us
back.
talk about that, and at least now you all know what the schedule is. If the test works, then we can adjust accordingly. If it doesn't work, then we know kind of what it looks like, so you all can plan for the remainder of the year.
Actually, the calendar doesn't look much different than the proposed by the time we cancel everything.
That's what happens.
some months,
When
that's
you
right.
look at
Yeah,
March
no-
and November and
November,
December,
December,
most cases we are
July.
in that 2 and 3.
Exactly.
Yeah. Thank you, Mayor.
Okay, that was good. So I think that is all we have. Final call, public invited to be heard. Is there anybody in the public? Strider, come on down. Thank you. You got our 6.
There you go.
Strider Benston, 951 17th Avenue. Let me congratulate the rookie council people and also the veterans who have, up until last week, who have returned. And the elections were, we watched every 12 hours they would change. And we haven't had anybody come in with guns and say that it can't be allowed. So that's significant. I'd like to honor Senator Max Cleland, who died today. He was a triple amputee from one of our previous wars. And then he went into public service the rest of his life, and he was elected senator, and he was one of the original members of the 9/11 Commission. And I'm not quite sure what happened. I don't know if he resigned because he knew they weren't going to look deeply enough into what happened, or if they threw him off because he would ask too many questions. I don't know if anybody knows for certain what happened. But honor to Senator Max Cleland. You've seen this week that Big Bird has been assaulted for being a government propagandist because in 1972 he said, "Don't wait, vaccinate." And we got stuff going on. I mix up Louis Gohmert and Paul Gosar because they're almost twins. But Gosar, all of his 6 siblings voted against him and put out ads to not let him be in Congress, but there he is. And he put out a video drawing of himself murdering Congresswoman Alexandria Ocasio-Cortez and suggested assassinating the President of the United States. If anyone else in the country except someone under the Trump bubble had done that, they'd be in jail right now and they would not be in Congress. That's what we're dealing with. And you got, but that party is saying they want to expel, or at least from committees, the 13 Republicans who voted for bridges and harbors and railroads. But you're going to keep Paul Gosar on, and the QAnon lady, Marjorie Taylor Greene, who has assaulted other members of Congress on the floor and in the hallways of Congress. So let's keep aware of what's going on and remember democracy counts. Thank you.
Thank you, Strider. So, Mayor and Council comments. Councilwoman Martin.
Thank you, Mayor Peck. I wasn't going to have any comments tonight, but I need to say what Strider said. Democracy counts, and it absolutely is at risk, and I don't want anyone to forget it.
Thank you. Harold? City Manager?
Yeah, I'm actually going to move up here tonight. So earlier, the slide that I was looking at in the COVID, so someone said, what are they looking at in terms of when new restrictions would come into play? And you may have remembered this slide here, where you have the blue line, and that's where the governor said is when this line crossed is when they will, and this is Denver Metro hospital admission rates by county, and this is a 14-day moving average. And so what I'm going to show you is when you look at Boulder, and you see where we were when I mentioned there was only actually a short time when we crossed that threshold that they put in place. It was really at this point in time in the end of November. Now, what I want to show you is when you say, how do we relate as Boulder County to other places? And again, these are the metro counties. This is what it really starts looking like. So you saw Adams and Douglas and it looks like Arapahoe. They got pretty close recently to that threshold. But again, putting it in perspective to see in the red line where Boulder County sits in terms of that hospital admission rate. This is the piece that they really designed at that point in terms of what would trigger what we kind of saw early last year, and I don't think they've changed this yet, but we'll double check that. But this was the map that I wanted to show you all.
Oh, great,
Or
thanks.
not map, graph.
Very, very helpful. Thank you for looking for that. So, City Attorney, any comments?
No comments, Mayor.
Thank you. So I guess that's it. Can I have a motion to adjourn?
So moved. Second.
All right, it has been moved and seconded. We are adjourned. Got that.